You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with chiropractor Dr. Dennis James of Performance Chiropractic Clinic, located in Keller, Texas. Dr. James is a nationally recognized chiropractor and member of both the American and Texas Chiropractic Associations. He is also trained in acupuncture and is a fellow of the Acupuncture Society of America. Dr. James specializes in family chiropractic care, treating infants to seniors. Today we're going to talk about a very important topic. Headaches should not be a normal way of life. Hi, Dr. James. How are you today?
I'm great, Liz. Thank you.
Well, thanks for joining me. So, can you describe the different types of headaches and the symptoms of each?
Absolutely. And one thing that I really want to address, Liz, is the fact that there are different types of headaches, but one type that doesn't exist is a normal headache. There's many times that I sit down with patients in a consultation, and we're correlating all of the different effects that they may be experiencing, the different symptoms that they may be having. And as I sit down and I ask so that I can determine what the cause is, I'll say, hey, how is this related, and is it causing any headaches for you? And people will respond with, well, just a normal headache. And it's something that has always kind of resonated and bothered me a little bit, because if somebody believes that they have a normal headache, then that believes that they don't actually think that they can do something to create a better life for themselves. And so what I'm hoping to do is kind of bring clarity to everybody that they can choose and make sure that we can get rid of the dysfunction, whatever's causing the headaches itself, so that we can create health for them down the road. And depending on what portion of the neurological system is affected, there's many different headaches you can get. I would say the most common headaches that we get and see are going to be tension headaches. As most people know, those are headaches on the back of the neck. They can come down to the shoulders or up to the base of the skull, and can even come around to the front side. You have sinus headaches, which is often accompanied with sinus congestion, pain and pressure behind the nose and the eyebrows. Chiropractic gets wonderful results with migraines per se. It can happen on one side. It can be the whole head. You can get auras and nausea and vomiting, and these are extremely painful. And they can even last longer, sometimes 3 to 4 hours every time you get them, up to 3 or 4 days in significant cases. Another significant type of headache would be cluster headaches, which, Liz, these are just debilitating. They can happen just numerous at a time. They tend to be one-sided. You get watery eyes and very, very painful to the patient. But the last one that I also want people to understand, especially people that think you can have a normal headache, is going to be rebound headaches. Because rebound headaches occur from overuse of painkillers. And so many people tend to think that the way to get rid of a headache is to pop an aspirin or an Advil, and now you're going to have residual effects down the road as well.
Great, and that leads me to my next question. So why is it bad to rely on pain medication to try to relieve headache pain?
Oh, wow. Well, that's exactly because pain medications, Liz, are used to basically block the pain and get you through your day. And so it actually blocks the neural impulses that go through there so that you can have some relief. But they never actually fix a problem, and they never actually create health. And so the way I look at it and try to explain it to patients is this way. You cannot ever have a negative create a positive. Only positive creates positive. So when we take a look at it and we say, hey, I have a normal headache, well, that means that you think you have something that can't get better, so that's a negative response. But if we're able to go find where the dysfunction is and create a positive result with that dysfunction to create a positive function, we can actually see pain go away because the function is restored. On the flip side, when we're dealing with those pain medications, if we take a pain medication, the common thing I like to ask patients is this. If you are perfectly healthy and you take an Advil or you take an aspirin or some other painkiller, are you going to be healthier after you take that or before? And the common answer that I get is that, well, you're going to be healthier before. So my response when I follow up with that is, well, why do we think then if we have a headache and we take a pain medication that we can actually get to complete health? Because a negative cannot create a positive. And what happens is even if we start with Advil or we start with aspirin, you're just covering up symptoms down the road. And even though it's important at times because you've got to be able to get through the day, if we don't actually ever take a positive, direct approach to restoring the function, it's going to build up down the road, and it becomes a very cyclical effect down the road to where you end up not having a quality of life. And that's what we're most concerned with.
And What chiropractic methods and techniques do you use to treat headaches?
Well, in our office, I have one very simple thought process when a patient walks in the door, and that's going to be I'm going to do whatever it takes to get the patient well. So there's many different chiropractic techniques, and we're trained in a majority of them. But with that being said, we are specializing and trained in a very specific technique, a very light force technique, a very gentle technique that doesn't require any twisting and turning. Patients either lay on their belly or you can even sit up and treat it. It's very, very good for pediatrics, infants, up to geriatric because we treat a lot of families and different generations in our office. And so whatever it is, we just want to restore that neurological function. But that would be the most common thing that we do in our office.
And can acupuncture help alleviate headaches?
Oh, absolutely. And acupuncture actually gets a misnomer because acupuncture is actually under the subheading of meridian therapy. The point of acupuncture and meridian therapy is to actually balance out the energy flow within the body because somewhere it's not balanced, which means that you have a dis-ease and there's not harmony within the body. So if we create ease, we can get rid of the disease, so to speak, and create harmony so that the body actually creates health, not just treating a symptom. And so when it comes to acupuncture, you can do needles, which is going to be long needle insertion, short needle insertion, but you can also do things that are not needles, so moxibustion, teishin, acupressure. And Liz, in our office, the most common thing that we do for headaches is acupressure because it is so effective, it is so comfortable for the patient, and the vast majority of the time, especially with headaches, they walk out of the door already feeling better. So it's a very good technique to use.
Great. And lastly, what are some ways people can try to prevent getting headaches?
I think most importantly, you have to look at your lifestyle. Especially in this day of age, I really believe that posture is a complete epidemic. The number of people sitting at computers every single day, how much time we spend on our iPhones and iPads and computers and playing games, especially our children and how they're being brought up, it's a concern because the best analogy I can give you is taking a bowling ball, which if you take 8 to 10 pounds is going to be about the same weight as your head, and you hold that up next to your head. As that moves forward but your elbow stays still, the stress that goes on your forearm to hold up that bowling ball becomes exponentially more for every inch that it starts to move forward. And the same thing's happening with our neck and head. So as we're leaning forward, as we're not having the proper posture, and we're doing that for 8-10 hours every day, the strain on those posterior elements, the muscles and ligaments on the back of the neck, becomes huge. And that's what leads to what so many people call normal headaches, but they're tension headaches because of the amount of strain on there. But you can also take an aspect from decreasing inflammation through your diet, which can be done. You want to make sure that we limit the toxins that are coming in, so decreasing painkillers, decreasing the amount of alcohol that we put in our body. We want to make sure that we are completely hydrated, getting enough water, which most people are underhydrated. We want to make sure that we're getting adequate sleep and that our nervous system is balanced to where we drop into that REM sleep and our body's actually regenerating. And then lastly, Liz, what I think is probably the most important is your morning routine, because wherever your mind is typically going to be what you pull to you. And when you see all these things going around you, it's tough to overcome it. So waking up and being able to renew your mind daily on what it is that you want, on where it is that you want to go with a vision of what you want to accomplish, that's the most important thing, is that your actions can follow through the day and actually create health as you move forward.
Well, thank you so much, Dr. James. We know you're extremely busy, so I just want to thank you for your time and help today.
Oh, thanks, Liz. I appreciate you having me on.
And for our listeners across the country, if you are interested in speaking with a doctor, please visit www.performancechiropractic.clinic or call 817-337-3636 to schedule an appointment. And on behalf of our team, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading experts.
You've been listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.